It just breaks my heart when a pet is frightened or even panics in the veterinary clinic. They need protective vaccinations, and if they get sick, it's our job to help. Well, there's no need for struggle because we have fear-free pet care. In case we haven't met, I'm veterinarian Dr. Jeff Nickel, along with our family border collie, Miss America, and Gaston and Tony. They're operating out of these indoor hunting feeders, these little food dispensing toys for cats. It's what keeps them happy during the Facebook Live events. It keeps them on the table so I can show off how well behaved they are. Anyway, I'm really glad you're here. I'm residency trained in veterinary behavior medicine. I've practiced general medicine for many years, and I've dealt with a whole lot of pets who have been frightened about being in the veterinary clinic. In fact, Sally, wonderful. Dr. Sally Foote is a colleague and a friend of mine who does a lot of work with low stress handling. She has taken on the methods of Dr. Sophia Yin, our late colleague, who did so much to teach veterinarians and their staffs and pet parents about how to manage their pets in many different contexts in ways that don't cause them to be stressed. The trouble with pets who are, frankly, freaked out in the veterinary clinic is that it does not take very many repetitions before they're just uninterested in coming back. It's one of the biggest reasons that cat parents too seldom take their cats to the veterinary clinic for routine care, for exams, for dental evaluations, to have their hearts checked, and as they get older to have lab profiles done so we can know that maybe we better start with medications to keep them going better longer and they don't come in. And oftentimes we don't find out until these kitties and sometimes dogs are just much sicker than they needed to be. And the problem is that these folks are understandably concerned about their pet's well-being if they have shown fear previously in the veterinary clinic. There have been studies show that 25-30% of pets are pretty darn nervous and tend to panic in the veterinary clinic. Well, a recent study showed that 78% of them are at least somewhat nervous or afraid. That's 22% of them who are just relaxed and cool. Well, your veterinarian can prescribe as needed anti-anxiety medications that can be given a couple hours prior to, often best started the night before, and then a couple hours prior to leaving home for the appointment to go to the veterinary clinic, that can just calm them down and help them feel better. And even if they're not a pet who tends to struggle and lose control of themselves, you want them to feel better. Even if they're, whoops, you lost your hunting feeder behind me, Tony. There you go, baby. Oops. He's emptied his, Carolyn. Maybe you'd give us a reloaded model here. Of course, there's dry cat food sitting behind me, so he may, goose me in just a minute.
Put it closer to the front so that it's
all right. That's a good idea. Okay. Thank you. And you can take that empty. There, we'll put it over here. There we go. Thank you. So, anyway, what we're going to do here is talk about how to make it easier for these pets and maybe how to find a veterinarian and a staff who understands how to do this. So, I want to tell you a story. A couple older folks, Ann and Cliff, really nice people, really dedicated and committed to this dog they love named Rose. Well, Rose is only about 3 or 4 years old, and of course I'm a veterinary behaviorist in specialty practice, and nearly all my cases are referrals from general practicing veterinarians. And Rose was sent to me by a colleague who just was unable to take care of her, could not handle her, couldn't examine her, and knew that we needed to be able to get this pet manageable so it could get the medical care and preventive treatment that it needed. So they sent Rose to me, and the first thing I do is not approach the pet and its family, because we're in a building, and of course dogs and cats are really not genetically programmed to live in structures with walls. Their concept of interactions is that they're happy to work with you unless they get scared. And they have an innate need to escape or avoid, which in the wild, of course, they can do that. But in the contrived environment of our homes and a veterinary clinic, there are walls. And especially in a small room, like an exam room, they can easily panic. And so what typically happens, and veterinarians and their staffs are well-meaning people, and they're in this line of work for the right reasons, but they sometimes don't understand what happens with scared dogs. And I want you as the pet parents to understand those things so that you can get the care for your pets that they need without the stress. So instead of the doctor or the technician, nurse, being already going out there to invite the pet and the person in and approaching them, or the nurse takes the history, maybe gets the vital signs of the pet in the exam room and leaves, and then the doctor comes in. Well, the doctor or the nurse is walking into a small room occupied by a cat or a dog who might say, oh my goodness, if I want to create distance, how the heck do I get out of this situation? And of course, there isn't any way that they can. And so for them to become frightened and defensive aggressive, you can see how it happens. And the place to begin with all this is to recognize early that that pet is showing signs of stress and fear early on. So there are ways that we can work with this. So I told Ann and Cliff with Rose, let me tell you what I want to do is take Rose to a much bigger room in the specialty hospital outside the exam room so she wouldn't feel so darn confined. And I took her to the treatment room, nice big room, and at that moment, fortunately, there were not a bunch of emergencies and other things going on. And very slowly, as I led her into the room, and she followed me, I was not approaching her, she was coming along with me, a little behind me, understandably, and we walked into the middle of the room, and I asked, very carefully pick the nurses who are very good at following instructions and being very relaxed and low-key, and I asked Yana, who's one of the best, and I said, Yana, please come along from sort of the side, very slowly, and I squatted down next to Rose's shoulders, sort of the way I am with Miss America. Honey, can you sit up for a minute? There we go, like this. And I'm sitting next to her, all right? And so Yana did the same thing. So we had Rose between us, my shoulder to Rose's shoulder, and our nurse Yana's shoulder to Rose's other shoulder, and we're holding Rose very carefully, very slowly, moving very quietly. Now, staff at veterinary clinics, they work there because they love pets, and that's a wonderful thing. But the problem is that sometimes people feel like the pet's going to relax if they talk in these high-pitched, happy voices. No, that's not the case. These pets just tend to get more agitated. And, oh, Twyla, thank you. Yeah, absolutely, I know. Twyla's getting a new pet. So this is very helpful for you, and in fact, I'm going to explain in a minute how to find the right veterinarian. So, so here's Yana on one side of Rose, me on the other, moving our hands very slowly, and I was able to do a nose-to-tail physical exam. I was able to get the blood profile that I needed from Rose. And the folks also asked me if I would do a nail trim. Now, they had explained that that had been tried at groomers and at the veterinary clinic. The doctor who was smart enough to refer the case, rather than saying, we're going to restrain Rose, we're going to hold her down, and we're going to do what we need to do. No, 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 no. This doctor said, look, we're sending you to Dr. Nickel. He's a veterinary behavior specialist. He'll understand how to help us with this thing. So, very slowly, I moved my hands down Rose's legs, had a nail trimmer in one hand. When I got to her paw, I just tilted her wrist back just a little bit and brought that nail trimmer very slowly to the first nail and just very carefully, slowly nipped off a point and then waited and then moved to the next nail, very slowly brought the nail trimmer next to the tip of that nail, nipped off the point. People make the mistake of believing, well, we're going to give this pet a really good nail trim, and they cut off too much and they get to the area where the blood supply is and that's painful. Well, no wonder these pets hate that, right? So super slow, and when we're done, I give her a treat from my treat bag and I stand up and we walk away, okay? Took her back into the exam room and I explained to Ann and Cliff, well, we did fine. Trimmed her nails, got the blood sample, and Cliff said, so how did she do? And I said, well, we moved slowly and we didn't have any trouble at all. And he looked me right in the eye and he goes, I don't believe you. Huh. You know, a person could get offended by that, right? I'm an honest person, and I'm an ethical practitioner, and I don't feed a line to my clients. If there's a problem, there's a problem. I understood where Cliff was coming from. He saw no way that this dog would work with us because it had never happened before. So I said, well, Cliff, let me tell you exactly how we did this, and I explained what I just told you with slow movements on this thing. And I said, let me show you. Well, at the end of the hallway where my exam room is an open area, and I said, you and Ann, please hang way back and watch from a distance, and please remain silent. And I very slowly led Rose down the hall to this open area. It's low light, which is valuable because light is another stimulus, and we're trying to keep those controlled. And I very, very slowly squatted down next to her shoulder. There's no face-to-face, eyeball to eyeball, certainly no leaning over, because all of these things trigger fear. Squat down very slowly next to her shoulder, so we're side to side like this, and I very slowly petted her, moved my hands very quietly. You don't take your hand off the dog, you try to move it continually, and very slowly down to her paw, and just moved her wrist back a tiny bit and brought the nail trim down and touched her paw. Now, of course, I'd already trimmed her nail, so I wasn't going to do it again. And he was frankly astonished. And this isn't, as they say, rocket science. The trick that we understand in the specialty of behavior medicine, yeah, anybody can learn to move slowly and carefully and non-threateningly, but the real key to this thing is recognizing the early indicators of stress and anxiety in these pets. If they're looking away, if anybody is anywhere near them and they're leaning away, often they'll growl, which people believe is aggression. It is not. It is verbal communication from a different species that's been telling us, hey, you're making me really nervous. But how many people understand how to read canine or feline body signaling? Well, pet parents aren't expected to. But when you see them lean away or turn their head away and look at you with what we call a whale eye, where their face is turned away, but their eyes are faced towards you, so the white part of the eye, that crescent moon, is visible, called a whale eye for reasons I don't know. I was telling you that that pet doesn't want to be involved but can't take its eyes off you because just by being there you're scared. And in fact, your dog may do that with you. Might love you and be completely devoted to you and sometimes get frightened. We avoid that stuff. We never reprimand fear. We don't scold or punish for growling. We say, you're nervous. I'll give you space. And then we find a way to not approach. I think I have a question here. Good point about the voice tone. Thank you, Doc. I love it when my colleagues comment, especially when they tell me they've got a better idea, because we can all learn from each other. So, we did very well with Rose. And so, tell me, if your pet has these kinds of issues, or if you know somebody who does, by all means, put their name in the comment line so that they can get this Facebook Live later and maybe learn something that'll be helpful. In fact, you know, anybody else is watching, by all means say hello and tell me where you're from. And if this is useful information to you, maybe you hit the heart button so I know I'm doing something valuable. And I think you can hear me loud and clear, but if you hit the wow button, I'll know that you do. So, you might have heard this about medical care for people. I certainly have. Fortunately, nobody in my family has needed any significant hospitalization or anything like that. But I got to tell you, I've talked to people who have. And this is not to dump on the human medical establishment. They're committed people as well. But these are big organizations. And mistakes can get made. And people can sometimes get lost in the shuffle. And patient advocates can be hired, if you have the money, to look out for that individual patient. And in fact, you'll hear oftentimes, take charge of your own medical care. Don't just move along with the system. Not that you can't trust people, but you need to be watching out for mistakes. Well, you need to do the same thing for your pet's medical care. And when it comes to the stress and the fear, and in some cases the panic, where they struggle, they might lose control of their stool and their urine, they might express their anal glands, they might try to bite. Ooh, we don't even want to flirt with those kinds of issues We want to recognize that the pet might react early and then take another approach. And in fact, in some cases, I've seen pets get so freaked out so quickly that I go to the pet parent, let's hold off for today. Let's not do anything today. Instead, I'm going to write a prescription for you for as-needed medications that you'll give before you come in for the next appointment. And I'm going to talk in a minute about a sedative that we can give in a very low-stress way, not by injection, for pets who they need sedation. Because we're going to avoid the fear, and we're going to give good, thorough medical care. Okay? So, somebody else had a comment. Oh, Cindy. Hello, Cindy. Thank you for coming. Great to always see you. So, here's what you need to do for some pets. Some pets might take a swing and it's hard to see it coming. And you need a veterinarian and a staff who doesn't have to worry about that. So some pets will do well with a muzzle. Now, this is called a basket muzzle. Let me show you that. This is a very lightweight, kind of a rubber sort of muzzle. And this particular brand is called Baskerville, like Hound of the Baskervilles. And what's best about these is they come in multiple different sizes and different lengths for dogs with, long noses like a greyhound, or a short face like a pug, or different size dogs. You want these things to be comfortable. And one of the beautiful things, Carolyn, if you'd pass me a couple of those nice long treats, I'll show you what we do. Let me tell you first what we don't do is we never put the muzzle on the dog, ever. Instead, the dog chooses to put her face in it. So you notice the Baskerville muzzle has this opening here, and I can put a treat in there. So Miss America, who doesn't really need a muzzle, but I primed her for this, she put her face in it, okay? And so when you teach a dog that good things happen when they wear their basket muzzle, you don't just do this before you go to the veterinary clinic when you might need it. You do this multiple times at home. So the dog says, oh, when you bring out that basket muzzle and I put my face in there, then there's this little snack waiting for me. And you notice that I don't just, as soon as she takes that treat, shove it on her face. Oh, look at her. She says, is there another one, Dad? Carolyn, if you don't mind handing me just a couple more if you have them handy. So you want the dog to say, great things happen when I wear this. And another nice thing is not only is that little space available in the bottom of the basket, the Baskerville muzzle, thank you very much, so that the dog can put her face inside the basket muzzle and take the treat, then while she's wearing it, even after she's gotten fully accustomed to it, I can give her a treat just to reward her for being good about the whole thing. Okay? They've got nice rounded edges. They're very comfortable. You can buy these fabric muzzles that are kind of sleeve-like and a little bit cone-shaped, and you put these on the dog's face and it holds their mouth completely closed. They can panic with those because they can't pant. The beauty of a well-fitted Baskerville muzzle is that they can learn to drink with it, they can pant with it, they can bark with it, they can do everything but eat and bite. And so if you've got a dog who might be a risk for the staff and the dog is wearing a basket muzzle like this, then the staff just says, okay, we don't have to worry about that problem. And I'll tell you why. It's not like dogs take advantage of people who are showing fear. They don't. But if people are nervous and anxious, many nervous and anxious dogs will react to that body signaling from the people. Well, we don't need that. We need staff that's relaxed and confident, and it's a lot easier for the staff if they're not going to worry about getting bitten, frankly. And they can move slowly, and they can touch the dog, and they can pet the dog or the cat, and they can move their hands slowly, and there's just one thing they don't have to be worried about. Okay? So it sets everybody up for success. So what if you've got a dog who's really nervous inside the building, but maybe less so outside the building? Well, here's something many veterinarians do, and it's a good idea for them to shed their white coat before they go out there. So what we do is we have people come to the front desk or call on their cellular phone and leave their dog outside. And if they can position themselves and their dog maybe on the other side of their car so that the dog does not have a direct line of sight with the front door of the veterinary clinic. And then the doctor comes out, ducking away from the front door, and goes to an area near the building, but not near the front door, because many dogs associate the front door with being fearful, right, girlfriend? So so then you squat, the doctor squats on the ground with their back turned toward the pet parent and the dog. The pet parent then, from a good distance, leads the dog up next to the doctor, just like I was explaining what I did with Rose. And very slowly, and then the pet parent can squat down on the other side of the dog's shoulder. I'm right-handed, so I always have people lead the dog up to my right side, and I've got Miss America on the other side. But because I'm right-handed, that's the way I examine a dog or a cat, and we all move very slowly. And what we've avoided is the fear and the anxiety that the dog can often feel when it's inside the clinic or even near the front door of the veterinary clinic. And I don't have my white coat on, and we're all, if we talk at all, very quiet, very low tones. Keep the stimulus very, very low so the dog doesn't go, ah, right? Because they're prone to that anyway. And if we have prescribed medication as needed, anti-anxiety medications at home prior to, these things get much easier, okay? So what you really want to do is you want to have a veterinarian and a staff who are sensitive to these special needs pets. And many of them are not, and many of them are. And you need to ask. And Trialer, for example, before you take your puppy in for its first vaccinations, you need to find who's available, who understands these concepts. They don't need to be a residency-trained veterinary behaviorist like I am. General practitioners, many of them, are certified fear-free. Now, let me show you something, and I'm going to hold it up behind my camera here, because there's a few great organizations. Let me turn this thing around here. There we go. The first one, that's the logo for Fear-Free, and you can see I've put the web address at the top, fearfreepets.com, and they will certify doctors and their staff and dog trainers and groomers and pet parents as fear-free. Of course, these are different courses. They're all taken online, and it's a great way to find a doctor and a staff who's committed to this stuff. Here's another really good one, and this is one that Dr. Sally Foote, who's part of our meeting right now, and it's called Low Stress Handling. And this is another organization that certifies pet professionals. And you know when they're certified that they've taken the training and they're committed. And here is their web address. And in fact, I'm going to make it a point to put this in my Facebook page after we're done with this Facebook Live. So you can go to these websites and you can put your zip code in and you can search for a veterinary clinic nearby. And here's another one for cat parents. It's called the Cat Friendly Practice. And you can see catvets.com. This is part of the American Association of Feline Practitioners. These are doctors, many of whom have cat specialty practices, or they may treat dogs too, but they're very serious about caring for cats. They're very well educated in the particulars of cat medicine, but they also understand how to recognize a scared cat. So that's catvets.com, that's lowstresshandling.com, or fearfreepets.com, okay? And I'm a real believer in these things, I'll tell you what. So, I need to turn the camera around, don't I? There we go, okay? So, what else can we do? Well, sometimes we have pets who are way too freaked out, and all of the methods that I just explained aren't going to get us anywhere, and we still need to help them. Well, we have injectable sedatives that we can give into the hip muscle, okay? But you've got to hold that pet still. And they're in the corner of the room, and here comes the doctor and the nurse, and the dog has no escape. They can freak out, and we're not going to even go near that kind of scenario. Instead, we can have the pet parent administer a sedative right when they arrive. So let me show you this. This is something that is not canine or feline approved, but we have one very good, robust research study. This is actually an equine sedative. It's called Dormosedan. It's meant for horses. It's cleared for that species. And it's a gel, Dormosedan, okay? And I have used this on many dogs because people send me the tough cases, which they should because I'm a specialist, okay? And where you got my seat all turned around there, girlfriend. Here's what we do with this stuff. It comes in a gel, and it is meant to be given between the lower lip and the gum, okay? And because it's made for horses, we convert a pet's weight in kilograms to body surface area, meters squared. Many cancer chemotherapy drugs are dosed this way, and so is this medication. And then we measure it into a little syringe like this. This is a 1 cc syringe, has no needle. This is not an injectable, it's a gel, okay? And we put it in the dog's mouth, and this is a sterile syringe, so I'm going to demonstrate with my own mouth, between the lower lip and the gum, okay? So we give this measured amount to the pet parent, and they go back out to their car, and they've already trained their dog to this. And Miss America, I give her Cilio when she has storm phobia, and we very slowly, oh honey, it's all right. It's all right. Very slowly. I don't have peanut butter on this like I usually do. And put it back in here and push the plunger and deposit this little glob of gel. If the dog swallows it, nothing happens. It goes down into the intestinal tract, digestive enzymes break it down, and there's no benefit at all. So it's got to go between the lower lip and the gum, and we teach people how to use peanut butter to teach the dog that it's a fine thing. And you deposit it in that little spot between the lower lip and the gum right there, and then I close the dog's mouth, and I hold their little mouth closed so their tongue can't come out and flick that little glob of gel out, and it can absorb. Hold their mouth up for a couple minutes. I teach pet parents to do this out in the car or next to the car, but not in the veterinary clinic. And then we have them lead the dog in, and we've already have an open exam room ready for them. It has a nice fluffy pad on the floor. I have another thick towel folded up on the table along with a basket muzzle. Okay? And the light's off, and they're in there, and the pet parent and the pet relax for 50 to 60 minutes. I know, it's a while. The light's off. No staff member drops in and goes, everything going okay in there? No, because those are stimulants that will trigger sometimes arousal in the dog, and we want everything quiet so they can absorb that dormosedan gel and quietly get sedated. After about 50 or 60 minutes, the light's still off. Pet parents are in there reading their email on their smartphone, you know, whatever. And they, you know, at 50 or 60 minutes, they put the basket muzzle on their nicely sedated dog, and then they put that other thick folded towel over the dog's head, lying on their side, so that this way when we come in, the doctor and the nurse, we already have our plan. We don't have to talk. If we do extremely quietly, we're minimizing stimulus, switch on the light, which doesn't trigger a response in the dog because its face is covered, and we can do an exam. We can take a blood sample. We can give vaccinations. We've even taken x-rays that way. Make sure everything is good, and then we can wake the dog up. There is an injectable reversing agent, and the dog's not going to react to that because it's good and sedated. And 15 minutes after that reversing agent is given, these dogs are on their feet and ready to go. No designated driver needed. So it's a beautiful way of doing this, and it is zero stress. And a doctor should do no harm. And again, not every veterinarian understands these things. They're well-meaning, but they don't teach behavior medicine in veterinary school, except in a few cases, and generally only to the students who are truly interested. It needs more attention, doesn't it? And it's your job to be your pet's advocate, to find a veterinary clinic that is certified fear-free or low-stress handling or cat-friendly practice, that they already get it. And if you don't have anybody like that nearby, but your veterinary clinic says, yes, we do give special consideration to scared pets, you're off on the right foot, and you can work with this thing. So, yeah, we've got ways of doing this, and we don't have to scare pets, and we can still deliver high-quality medicine. Anybody else got any questions? I think that's most of it. I really appreciate people spending a little bit of their time with me and sharing your thoughts. And if you have other questions, by all means, go to my Facebook page and type them in. It doesn't have to be about pets who are scared in the veterinary clinic. It can be about anything pet related. It doesn't have to be just behavior. I've spent many, many years in general practice, and I still stay current on those things because so many of these pets have other problems. influence their behavior. So we pay close attention to that. And well, Diane, thank you. You're welcome. And I love Fear Free. Kimberly, I'm delighted that you're aware of Fear Free. It is a wonderful organization developed by Dr. Marty Becker, who recognized the need. And it's a very well-organized group. They have board-certified veterinary behaviorists who have developed these training programs, and they are just top flight. So if you've got that, or somebody's been through the low-stress handling course, they all teach pretty much the same thing. And these are people who are dedicated to taking the fear out of veterinary medicine. So thank you again. And I hope you find this information useful. You're welcome to share this Facebook Live with any of your pet-loving friends. And you can get these Facebook Lives and my weekly, what we call the media blog, which is a question-answer column that I've written for the Albuquerque Journal. It appears in the paper every Friday morning and has, without fail, since 1996, if you can imagine. I do it every week. And you'll get these in your email box every Tuesday morning by subscribing to my website, which is drjeffnicol.com, drjeff, N-I-C-H-O-L. And if you do, you can subscribe, which of course is no charge. And when I find out that you're a subscriber, I will send you, at no charge, my at-home pet first aid and CPR guide, which are worth printing out and sticking to the fridge, because if you have a disaster, you don't want to be fiddling around trying to find information. You want it handy. So thank you again for being here with me. I enjoy doing these things, and I hope you enjoy attending. There are people who come every darn week, and it means a lot to me. So I'll keep doing it as long as you folks keep showing up. So thank you, and have a great week, and everybody stay safe and healthy. And if you're not talking to a video camera, you ought to be wearing a mask and stay 6 feet apart, and let's all get through this thing alive and well. Thanks so much.